Let's celebrate us. Let's celebrate each other. We need to include perinatal perspectives. Be kind or be absent. Let's bring back the village. Emily Lewin, the perinatal specialist.
Keeping in mind the recent manifestos that were, and the UK elections and the manifestos that were released. So, sorry, let me get that on the side. Yeah, so regarding the maternal safety ambition plan, and I saw that you used to work as a midwife also, but I wasn't sure whether, oh, so sorry. So as a maternity nurse, because I saw that you worked as a maternity nurse and a birth worker, but I wasn't sure
Yes,
what, yeah,
yes, not a midwife, not a midwife. So
okay.
I train midwives, but I'm not a midwife myself. I'm non-clinical.
Okay, okay. So you never worked in the NHS system, is it?
No.
Okay, okay, got it. Thanks for clarifying
Does,
that.
does that impact
Sorry?
does that impact this discussion further
No,
or
no, 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 not at all. I was just clarifying that. Um, yeah, so regarding the safety ambition plan that was launched by the Tories, to halve the rate of maternal deaths by 2030, but or the latest data shows that it has increased to a 20-year level of high. Um, like going back to 2003, that's the rate currently, that is at 13.41 deaths per 100,000 maternities. So, and the data also revealed that Black women are 3 times more likely to die from childbirth, and Asian women are 2 times more likely. So, what policy recommendations do you think are crucial to address this disparity among ethnic minorities and more especially Black women?
I think the main thing we need to look at is education. So the education system is very Eurocentric and it's
Mhm.
built on a model that supports um, very medicalized care, but specifically for white-bodied and able-bodied people. So anyone that is outside of that um, is then already predetermined to experience some form of harm, whether it be through trauma, obstetric violence, systemic racism. And that's not the fault of the individuals within the healthcare system. It's actually the fault of the institution. Because if the only information they're being given from the point of education is racist, then their
Mm,
behaviors and their philosophical beliefs are all going to be impacting that even further, which is why we see such adverse outcomes for those because of disparities. For example, um, the fact that for many years and still to a degree is shared information within the education system that Black women have thicker skin and they don't feel as much pain when it's being penetrated and things like that can lead, it's really dangerous misinformation that can lead to further harm. Not understanding religious or cultural beliefs. It's not that everyone needs to be an expert or professional, there just needs to be compassion and respect. And without that, again, through intergenerational trauma, we've seen that there's a predisposition for us to have fear of those in the healthcare environment. And there is a breakdown in communication because of that. Because if you suffered trauma, and that's even if your ancestors through enslavement have suffered trauma, that's within you still. And the pain and fear that you're carrying when you walk into this institution, no matter what it's for, whether it's for birth or not, you're coming up against that fear. And I mean, if you look at any form of mental health care, sometimes the re-traumatization or even vicarious trauma, if you're there as a supporting partner, is just as impactful. And it's not being recognized. When we talk about things like obstetric violence, it's not necessarily that someone has physically caused harm. It could be emotionally, it could be manipulative, it could be coercive, and all of these things. And I think we need to be looking at the bigger picture, but starts with the education. because if they're ill-informed from the point of education, their practice can only remain ill-informed unless they personally seek to educate themselves. But even then, there's limitations because of policies and guidelines that say, well, you may want to do it that way, but there's only so much freedom with your clinical judgment that will allow you to use, because you have to fall in line with the institution's policies.
Yeah. Um, this is quite a chilling reality because I was talking to a student midwife and who is quite disturbed within the NHS system because she was talking about how Black women are generally considered to have more pain threshold. It's a general misconception among the midwife community itself. And I was seeing a Reddit post about a Black pregnant lady who had to face a lot of verbal abuse from a midwife because she was told that she's too posh to push because she opted for a planned C-section, and that it's yeah, it's very unsettling. And if you don't mind, could you share your personal experience with the maternity care system in the UK and what issues need to be urgently addressed within the NHS to ensure a safe childbirth experience, especially for women from your community and other ethnic minorities?
So I've had a varying degree of experiences. So I have 3 children that I birthed and 5 that I've lost. And I've had an induction, I've had an emergency cesarean, I've had um, I've birthed in distress on my back against my wishes, and I've also had a very calm hands-off water birth. So I've managed to go to both ends of the spectrum in my journey of parenthood. But I've also, as you know, accompanied many others, and their experiences within the NHS is really, really varied. So I guess the main fear is again, goes back to the misinformation, but also the lack of information. So there is a huge problem around the fact that they want to fix these statistics.
Mm.
So they're trying to look for quick fixes. And back in 2021, I ran the Not So Nice campaign, when they brought out the draft guidelines, the draft NICE guidelines, basically insinuating that all Black and Asian women, because they clumped us all together, after 39 weeks should be essentially having an induction because our bodies don't know how to birth. And along with that is, yes, medicalization is necessary in some instances, but birth is not an injury or an illness. And it's become so medicalized that when you look at the perceived social hierarchy within a hospital setting, we're putting consultants and doctors at the top of that hierarchy, and they're trained for medicine. They're trained for surgery. They're trained in a clinical environment for emergencies. So they have a very focused lens on saving lives through these skills that they've obtained through their education. However, they're not normally privy to physiological birth because that's not their area of expertise. Then just below, you'll have the midwives and the maternity workers. Now, they are to a degree trained in physiological birth, but they're also still within the system and the institution that is saying, actually, you're in a hospital setting. Your job is to treat and to fix. And then at the bottom of that hierarchy is where they put the mother or birthing person. And if they come with anything that is a variation of normal, that causes discomfort or is not within their skill set, it's a problem. So when you look at the fact that even postnatally, because it's not just during pregnancy and labor and birth, it's also postnatally. If you take a Black mother that has just given birth and they've started their breastfeeding journey and they present with mastitis, for example, I've had 2 clients that I've literally had to march back in because they've been denied care because they couldn't see. It didn't look like they had mastitis. There were no visible symptoms because they couldn't see it on that skin color. Now, one of these women has actually had a large part of her breast removed, and it's left her with a lot of insecurities around her body and her appearance. And she went to have 4 children, and she's never attempted to breastfeed ever again because she had such a traumatic experience. Now, that's because when you look at the education system, and it started to change, I think in the past 3 years, we're starting to see images of Black bodies breastfeeding and what different illnesses and ailments may present like on Black skin. But we're not fully there yet. So the education system isn't equipping the midwives and those that are trained in physiological birth to support people. Now, if you put that at an intersection of the LGBTQ community and a physical disability or even neurodivergence, or even if there's a language barrier, then you can see how it starts to complicate, because there's a limitation on skill set and education. And then there's a deviation from what is deemed as normal, because normal is a spectrum, but it's supposed to be one clear-cut thing on paper. So, for example, I was registered as disabled, and for various reasons, I have numerous health concerns. And because of that, it's almost like there's an element of overprotection. But that takes away from the birthing person's experiences. And if that doesn't meet their philosophical beliefs or cultural beliefs, then again, it's another form of harm or the potential to cause trauma. And birth trauma wasn't really acknowledged until 2016 or accepted. And still to this day, it's because it's on a sliding scale and it's not easily identifiable to everybody. If it's not something that would be traumatic for one, it may be deemed as non-traumatic for somebody else. And we can't think like that. And that's another area where I think it's really lacking. And we're not sharing enough information, because there's, as you know, the like antenatal education isn't regulated. So you have people that have had great experiences that, yeah, this is wonderful, I can do this, I want to teach. You also have people on the other end of the spectrum that have been through something horrific and they're like, I can't allow this to happen to anybody else, I want to teach. And then you have medicalized people that are trained in birth that want to share what they know and they teach. And then you have the non-medical, and they're just passionate, and they may have had an education to a degree and they want to teach. And all of the information is going out into the world. How, as a birthing person that is new to parenthood, how do you know where to turn? How do you know the misinformation from the TikTok gurus to the evidence-based information? How do you know if the information has been fact-checked? But equally, how do you know that there isn't anything missing? Because there's a huge fear around not giving people all of the information because it's overwhelming, it's scary, especially for Black women at the moment. They're going in scared because the conversations are public. People are talking about the fact that we're more likely to die. Our babies are more likely to die. We're more likely to have miscarriage. We're more likely to suffer from preeclampsia and all of these things. And it's scary. So from the point of conception, fertilization, or even just family planning, there's fear. And you add that to the intergenerational trauma and there's more fear. So what people are doing now is we'll give them a little bit, but not everything. But what we should be doing is making the information readily available and saying, this is what I'm giving you. Here is the rest of it if you should need. Because otherwise, if you then walk in and 3 weeks before your first baby, you're told, the baby's big, we need to give you an induction. You don't want your baby to die, do you? Well, no, of course not. But actually, what's the statistical evidence? When you look at me, my care plan, my history, my pregnancy, my medical history, is that relevant to me? Now I've got 3 weeks to try and find this information and come to a decision whilst I'm heavily pregnant and tired and trying to prepare for this new life, trying to protect myself. I don't have time to read through all of this information. So now I'm going to follow those that are going to essentially be taking care of me. But can they take care of me in a system that is flawed and is not set up to protect me? And that's where we sit at the moment. Stuck between fear, human rights, and a system that isn't fit for purpose.
Yeah. I'm so sorry hearing about your loss. It's cannot imagine what you must have gone through. When you talk about the system, we have hopefully a new government coming in, and do you have you thought about what kind of changes can the new government bring into the NHS and to make childbirth and maternity services safe for ethnic minorities as well as for women in general to reduce the maternal mortality rate. So, what are you hoping from the new UK government? I don't know if you've read through any of the manifestos because Lib Dems just released the manifesto today and it's based on NHS and fixing the system from top to bottom by taxing the rich, like a fully costed plan. But um, yeah, data show, I mean, not data, poll predictions show that Labour will be coming in. So, what are your expectations for that? Yeah.
I haven't read it this morning. I'm behind in time. So, I mean, if you have it and you could send it, that'd be absolutely fantastic. I'd love to read it. I tend to try and reserve judgment politically because I don't have a lot of hope either way. Unless the education system is reformed, and that's revising nationally the curriculum for midwifery with less add-ons and more mandatory. I'm not overly hopeful. And the reason I say that is because you have hospitals that work in diverse areas that will adapt. And you have hospitals that don't necessarily, and birthing centres that are not in a diverse area. And so they have obviously the mandatory elements, but if you're trained in this area and you don't have that diverse experience, it's the mentality of the individuals that come out of the education system. And to further elaborate on that, for example, I was teaching a group of medical professionals in South Wales, and they don't have a very diverse population. And we were doing a scenario-based exercise where we were looking at communication aids and how this may impact individuals. In January, we saw the Panorama episode where an Asian mother had lost her life due to lack of communication. Now, if you are not in a diverse area and you have someone come in that doesn't speak the language and you don't have these facilities to overcome adverse situations, for example, if there was a need for a cesarean section because of a hemorrhage or something, and or you didn't know, you had an asylum seeker come in, I'm trying to think of a better example, sorry, and you're unable to communicate effectively to gain informed consent, then what happens if they've got a history of hemorrhage? What happens if they have lost previously? What happens if they have an internal injury that you're unaware of? There are so many contraindications that you wouldn't necessarily be aware of if you have an asylum seeker come through the doors, because you haven't got the history and you're not able to find out verbally in that moment, which puts them in a vulnerable situation. And know that maybe one in however many, because the statistics are low and you don't have a diverse environment. But why is that one life less important than if it was 50? Why do we only care when it's the majority? And that's why minoritized and marginalized groups always suffer, because it doesn't matter, there's less. But actually, when you're talking about the global majority, those numbers are still significant. So unless the education system is updated and inclusive as standard, and this is looking at various degrees of intersection, because it's not a one size fits all, unless the hierarchy within the system is demolished and restructured, and we prioritize listening to people, and we recognize that birth is a physiological event, but for many it's spiritual, it's cultural, it's life-changing. Am I hopeful? At this point, no, because just coming out of this quick recession, I don't believe that the UK is currently in a position where they would do so, regardless of which government is in power. I think there's likely to be lots of conversations. I'm hopeful. I would love to be proved wrong, and we have a conversation in a year's time, and we both have an aha moment, and it's yes, well, they did it. It's starting, it's happening, we can see it in place. But realistically, I think if it wasn't for grassroots organizations, the community organizations and charities that are picking up the pieces of trauma and loss and pain, I don't know how society would look right now. And it's at a cost, yes, but the government needs to recognize, for example, that when a family has a child in neonatal care, the implications are not just the emotional turmoil, but when you think about the practicality of it, and having, if you have a child at home and you still have to pay for the fees, and or if you've had a baby early and you still have to be getting transport there and back and eating on the road, and it impacts your health in more ways than one. It impacts your well-being, it impacts your finances, your family structure. That could impact relationships for years and years to come. And that's not taken into consideration. It's, oh, but your baby's alive, and we've managed to keep them alive, and you're alive, so it's okay. And that shouldn't be the bare minimum of care. Being okay, being alive isn't the minimum. We need to strive for better. We need to allow people to birth and have experiences that change their life in a positive way, but are not life-changing to the point of trauma. I hear the word trauma on a daily basis, just in general communication. It used to be a word that when you heard it, you'd be stopped in your tracks, because it was something that was a bit rare. It was trauma that's huge, and people would stop and listen. But now there's constant trauma. We look around the world and there's trauma all day, every day, lives being lost, pain, bloodshed. And at a joyous point in your life, when you're bringing life into the world, that's now associated with trauma instead of the joy that it should have been. And that's scary.
That's that's actually incredibly powerful. I never thought of, trauma coming into when it should be a joyful moment, and how trauma has become so common now. Yeah. Um, yeah, we can only hope for better. Um, just one last question. Thank you so much for giving your time today. Just one last question. So, you talked about how trauma has become prevalent everywhere. So, in your conversations with the women that you work with, um, what are the most common issues or challenges that Black women have told you about, that they've faced consistently during this maternity process? Yeah.
Um, Oh, just one. There's so many. So it's fear, a lack of control, not
Mhm.
being seen or heard, not being understood, um, the disregard for beliefs, um, and the lack of compassion. But again, that's not the blame of individuals. That's on a systemic level because they're taught that if they're taught, actually, they're not feeling as much pain, or we're loud, or the perpetuation of the strong Black woman. You could do this. You're so strong. Actually, what if I'm vulnerable in this situation? My body is vulnerable. I am in the care of people that aren't educated to take care of me. I'm vulnerable. And actually, if you look at it from a spiritual aspect, you're spiritually open when you're giving birth as you bring in new life. You're vulnerable in every aspect. And then you hear these terms like, oh, leave your dignity at the door when you give birth, because so I'm vulnerable, I have no dignity, I'm not safe, I'm not being heard, and I have no control, I'm powerless. Where does that take you to? It takes you to a place where a white-led system is in control of you, your thoughts, your behavior, your body, and your culture is just pushed to the side. Your beliefs are pushed to the side. Where have we seen this before in history? Enslavement. So we went from being kings and queens to being led by those that enslaved us, powerless. And that's what I mean when I talk about the impacts of intergenerational trauma, because now it's the fear in the moment, but it's the fear of the past that is ingrained in our epigenetics. The fear that maybe they may have had fertility treatment because of what the medicalized system had done to Black women previously and how that impacted fertility and conception. All of these things create fear. So am I going to lose my baby because the statistics say so? It's really, really hard to be powerless in a vulnerable place where you have no control. And that in itself can take away the joy. And no matter how much hypnobirthing, breathing exercises, conscious laboring, lights, smells, we can try as hard as we can. But until the system has been changed, and I hesitated there because I wanted to say fixed. The system was created to do what it's doing. That was done with intention. So until it's changed in order to support all women and birthing people, it's not actually safe. And I think that's the fear for Black women, because now it's not just the fear that we felt inside, it's the fear that we hear about and we see on the news. Now it's talked about, it brings it really harshly into reality because it's not something you have in the back of your head anymore. It's right at the forefront. So yeah, sorry, that was a very long-winded way of saying I think it's just the fear.
Yeah, that's, I think we're 10 minutes more, sorry. Um, yeah, that's incredibly sad. And again, everything ties back to education and, fixing it from the bottom level, from grassroots. And education is the most important thing. So, yeah. Um, Thank you so much for sharing your insights, and it was incredibly helpful. And I will share the article as soon as I'm done with all my interviews and once I've finished compiling everything. And thank you so much for doing it even while you're away, like at Jamaica. And yeah, thank you so much for your time. And